All right, good morning, everyone. Welcome to the State of Health of Chicago series, our Leadership Summit and the 2021 Healthcare Awards. We're going to be joined by Andy Slavitt discussing his new book as a part of the kickoff of this meeting. And I'm Cheryl Rucker-Whitaker, your president and chair for this year, and I'm happy to be here. The agenda today, we will walk through upcoming event sponsors. We'll spend time with Andy Slavitt, our keynote speaker. We're going to do kind of a Q&A format with an opportunity for questions and answers. We'll have our awards presentation, our membership update, and closing remarks. I want to thank our Board of Governors. I want to thank the Executive Committee for a busy but productive year. Raul Garza, Lorenzo Pence, and Rick Ferraro serve on that committee. Mark Grach as immediate past chair. Courtney Avery, Cheryl Larson, Maurice Lemon, Pat Merriweather, Dorian Miller, Howard Nachumson, Jan Odiaga, Clark Stanford, Anita Stewart, and Nellie Vasquez Roland, and Dr. Leslie J. Sandlow in memoriam. The Institute of Medicine is an independent organization of distinguished leaders in the health field, working here in Chicago to address critical health issues through a range of interdisciplinary approaches, including fora like these, research, communication of trusted information, and community engagement. We have a lot of upcoming events for 2022. We look forward to your continued participation. In January 2022, we'll present our State of the Health of Chicago report with a look back on the State of the Health of Chicago convenings and some of the insights that we gained from those over 20 convenings. In February 2022, we'll talk about mental health, suicide, and trends. March, we move on to homelessness as a public health issue, specifically focusing on here, Chicago, Chicagoland, and the state of Illinois. In April, Rosalind Franklin University will be working with them on a panel around the intersectionality of education and community engagement. And in May, chronic kidney disease, its implication and trends, specifically focusing on the urban environment here in Chicago. We hope to convene live in 2022 for the annual meeting on June 24th. That will be the date where we'll have our annual required business meeting for our bylaws, introduce our new Board of Governors, and present our annual healthcare awards. I want to thank our sponsors, Blue Cross Blue Shield of Illinois, Northwestern Medicine, Rosalind Franklin University of Medicine and Science, the University of Chicago Medicine, the Portis Foundation, the Michael Reese Research and Education Foundation, the Washington Square Health Foundation, the Hectone Institute, and Complete Care, Aunt Martha's Health and Wellness, Care Advisors, Golden Square. So today's speaker, Andy Slavitt. Thank Andy for being with us today. Andy was President Biden's White House Senior Advisor for the COVID-19 response. He chronicles what goes on inside government and across the nation in town halls. In his award-winning podcast is called In the Bubble. He's very prominent on Twitter. He's the author of the book Preventable, which is a best-selling account of the US's coronavirus response for 2021. So Andy, welcome. We're glad to have you today.
Such a pleasure to be here with you, Cheryl.
Indeed. You are a very busy person, Andy. It's funny, you left the Obama administration in 2017, but it's as if you were running alongside the Trump administration in this book as a part of the coronavirus response. So first, I want to just thank you for your service. I'm not sure if that was a paid position that you were in, so we thank you. Yeah. So really a great sort of chronicle of that year. What made you keep such amazing notes that you were able to go back and write such a detailed account of what happened almost daily, if you will, with the response? And you start out as early as you tell a story about a woman, a 60-year-old, I think, creative, who probably experienced a really early case of COVID-19. What made you keep those notes?
You know, it was probably, at least in some part, my own therapy. Dealing with the year. I think some realization that it was an extraordinary year, one we hope never to repeat. And I have the privilege, and it is a privilege, It's a rare privilege to be kind of on the inside of a lot of things as they were happening. And, you know, the best way I kept the chronicle was every night I would put out a Twitter thread with all the things I learned during the day. And, God bless the people who talked to me and thought that they were having a conversation in confidence, because I never agreed to be an insider and remain an insider. I always wanted to share what I learned with the public, and because a lot wasn't being shared, at least at the start, there was a lot of denial and there was a ton of confusion. I felt like, I'll just pick up the phone because I have the privilege to do so and call the head of 3M or call a governor or call a scientist. And then whatever I learned, I would just try to report it back. And so it chronicled pretty well into these Twitter threads, because I was just trying to basically inform people of what I was learning. And, over time, I think it occurred to someone that, hey, this is a kind of interesting first draft of history, kind of told real time.
Yes.
Why don't you put it into a book? And so that ended up becoming, I call it my longest tweet.
Exactly. So Twitter thread, you may have coined that, right? That might have been because of you that we have that name. I think about this book, as almost like the 24 of COVID coronavirus response. So as I was reading, I was just thinking about Kiefer Sutherland. Like every episode, it was like, oh God, what's going to happen next, and how are you going to stop it from destroying the world? But it was kind of interesting. Several points you kind of share with us. That when the NBA shut down, can you talk a little bit about kind of what you were thinking? I mean, it's you talk about Mark Cuban in the book, and there's a meme of him responding. Somehow the cameras caught him learning that the NBA, I think it was during one of their games, right?
Right.
Like tell us a little bit about that.
Plenty of people write about that moment where Mark was sitting on the court side of the Dallas Mavericks game, and he had gotten handed a phone which told him that the NBA was shutting down. And he shared that with me. And what people don't talk as much about is the Minnesota 6A basketball tournament that I was at the very same moment with my son, who is all of almost 6 feet tall, and his team of teammates that were all almost 6 feet tall, playing against a team in a single elimination tournament that was much bigger, much stronger, much more dominant, and beating them to go to the conference finals for the first time in this little school's history. It was like straight out of Hoosiers. And of course, after the game, it was not to be. They were not to go on any further. So much more impressive than the Mavericks was our team of 6 foot tall 3-point shooters. But we were all disrupted. And what I was trying to do was capture the moment when, for everybody was something different, when we said, oh, is this happening? What is happening? Oh, this is real. And, Donald Trump had that moment in January. He just didn't tell us.
You have a minute.
Yeah, I'm in a board.
So he learned about this, as we know, in January. And it wasn't until the NBA went down that caused the stock market to also go down, that then caused the president to have to address the issue. So in some ways, it was very interesting, because this all started to happen when a basketball player named Rudy Gobert was sort of messing around with touching all the microphones and being silly, and it came down with COVID. And it was at that point in time that he really unknowingly set in motion the events that probably saved a lot of people's lives, because it became, at that point, impossible to ignore.
Interesting. I still remember that moment, right? Because that did sort of jolt us into a state of shock, right? When the NBA went down, right? Because so many of us, if you're from a basketball family, and lots of us watch a lot of basketball, right? And it really was a jolting moment. One of the and this is kind of a thread that you come back to a couple of times. You talk a little bit about the kind of the response, and then who's able to respond to it, and how it played out kind of from a equity perspective. You talk a little bit about the Peloton group of people, and the kind of, folks who, the non-Peloton group of people. Can you talk a little bit about your thinking as you were approaching your involvement around kind of the equity issues, and how were they coming to you, and how were you kind of processing the impact of that
Right.
as you were going through this work?
So you all could accuse me of being the king of oversimplification, and you'd be right. I generally try into communicating with people, try to keep things as simple, yet as real or as accurate as possible. And I think what I learned as a CMS administrator, being responsible for people who were on fixed incomes, low incomes, and really were at the mercy of the healthcare system, not much of a safety net, was how different their experience is with the healthcare system than those of us that have the privilege and luxury of being able to set appointment times, being able to see the same physician over and over again, or the same care team, from being able to access the internet, from being able to have childcare whenever we need it, not have to worry about our eating healthy. And so that got ingrained in me when I was at CMS, because those were the 130 million people that I was taking care of. So to me, the healthcare system, has got, it's got challenges for everybody, but for some people it's manageable, and for some people it just is almost designed to keep them out. And that's based on where you live. It's based on the color of your skin. It could be based on your income level. It could be based on a lot of things. And it's just too hard to penetrate. So that's true in normal times. During a pandemic, everything that is subtle becomes obvious.
Mm-hmm.
And so it became unignorable that, if you work for a paycheck by the hour, or if you get paid a salary, to say nothing of many of these other things that cause disparities, race, zip code, income level, et cetera, your life was very different during the pandemic. If you worked in an office and could afford to work from your home and had enough room in your home for everybody to have their own bedroom, life during this pandemic, the dirty little secret is life during this pandemic had a lot of advantages. If you were not in that situation, then it was very different. And that caused a lot of people to say, hey, I don't know anybody who's dying of COVID, with the implication that therefore, is it real? And my response was always the same, and I wrote about this in the book, is I was in a meeting with there were a bunch of corporate people, and someone came and asked me if I would speak and talk about what's going on with COVID. And someone said that, he made that comment almost in a very challenging way. And I said, oh, but I think you do know people who died of COVID. They're the people that grow your food. They're the people that drive your food to the distribution center. They're the people in the grocery store who are serving you food. I said, the people delivering food to your door at home. You may not know their names, but you know them. They're literally working for you all day long, their entire lives. And that's this disconnect in our society that I find made it very difficult for us to deal with.
So the climate we were in, so to that point, the sort of unequal system, but unequal health system, diminishment of, and you talk about this in the book, diminishment of public health civil servants and our important institutions, and then the political polarization just created this perfect storm for what we've experienced so far. At one point, you jump in, and because of the administration decided that the states were on their own. And so what made you decide that you would sort of jump in and help governors? You did a memo to governors, and you got a lot of callback asking for advice and support about how to, kind of tackle this, how to reopen, how to manage the response. Can you talk a little bit about how that lack of national response led you to kind of jump in with governors? And if there are any specific stories you want to share with us, of course, we
Sure.
want to hear them.
Well, look, outside of the big states, New York, California, and several others, try to imagine what in 2019 the public health department looked like at any given state, county around the country. Small, beleaguered, et cetera. Try to think about the expertise that a governor had when they ran for office in 2018 with regard to not just health policy, but public health. It was people were starting below zero. And so, and because all of the resources and budget to get things done are really at the federal level, and yet it was clear the federal government was going to be reluctant to act. It felt like that governors, every time I talked to a governor, I felt like, boy, they really need a how do I start kit, because their questions were not, super sophisticated. Their questions were like, how do I pick someone? How do I tell if someone's telling me the truth? If I'm looking at two different models that are telling me different things, what does it tell me? How do I procure a ventilator? How do I find PPE? Like, it was really, really basic. So this was, I said, okay, I'm going to write a memo to all the governors. And I just basically, again, used my privilege. I called, 4 or 5 former CDC directors. I called 2 or 3 scientists, basically the top 10 questions that I thought governors had in their minds. I just figured I would just call. I was bored. I like everybody else. I was home. I had nothing to do. So there I am, down on the phone, just calling people and asking them these questions. And then I just shaped it like a 3-page memo of bullet points that I could get out that afternoon to governors and their staff saying, okay, here's what you need to do now. Because the one thing that's clear is, like, people don't can't quite picture how exponential math worked. But it's like, if you act today versus a week from now, you're going to be managing a much bigger problem a week from now than you will today. So that's why I felt the need to just jump in and do that.
So Andy, this memo, it went to, I hate to use these words, but it went to red and blue state governors.
Mm-hmm.
Okay. Did you have as much response from engagement with red state governors as you did blue state governors? Like, was there a quote unquote political differential, or how did that manifest?
So I'll tell you that, like, at first, I was pretty naive to the fact that there was going to be a political difference in responses at the state level. I'm used to thinking of governors as very pragmatic, unable to avoid the problems. And at first, I think it was less political. There are a couple of red state governors, Ohio, Massachusetts, and Maryland, where you had very good responses from Republican governors. So I'm not going to blanket say that at the beginning everybody responded negatively, but it was really after like a month or so, and it was really as you got into mid-April that attitudes really shifted, where President Trump and Jared told me this personally, and this is a conversation with him that's in the book. He basically said, we're done with this. Now, what he said was, we're going to make the decision to open up the economy, give the president the credit, and then any bad thing that happens or anything that has to be shut down, the governors will do that themselves. And so they're going to get the downside. And he said to me that this was a pretty smart political strategy. Now, I couldn't get words out of my mouth because I was surprised, but it was not a good political strategy, and it wasn't a good public health strategy. But I will say this, like, maybe, if I'm being honest, 47, 46 of the governors did their very best, whatever they thought their best was. In some cases, they made mistakes. In some cases, they made bad mistakes. In some cases, they guessed wrong. In some cases, they guessed right. But I think there were 46 or so governors that were trying to do what they thought was right. And by the way, they each thought something different. Some of them had different value alignment, but they were trying. And I try to be very forgiving of people who are making honest mistakes. If people are making dishonest mistakes, and there were some of those, I'm not as forgiving. But if you were in charge of a state and you tried your very best to save lives and keep people going and keep the economy going and keep schools open, you were in a no-win situation, and you get a lot of credit for just showing up, talking to the public, being honest. And most of them did that at the beginning, for sure.
There's a section of the book that talks about Easter Sunday, and that really does remind me of an episode of 24. It's like, oh no, we can't let this happen. Like, we can't let them sort of open up the economy with no, you know what I mean? Like, you're like, We gotta stop it. Talk a little bit about Easter Sunday, the run up to Easter Sunday. Like, did you sleep at night? Did you sleep those nights before, trying to stop them from making some broad public announcement that would leave us vulnerable to, even worse, worsening numbers and multiples going on with the COVID kind of, response here. Talk a little bit about that.
So remembering back then, unlike today, we didn't have any tools. We didn't have vaccines, we didn't have antivirals, so we just had basically public communication and our own ability to not spread the virus. And so when we were at the end of March and we could see that the cases were going to peak and start to drop, and that's exactly when the president came on TV and said he wants his churches filled, he wants them packed Easter Sunday, elbow to elbow, seniors, no masks, etc. And to a lot of us, that was that it just resulted in a lot of people dying. I don't want to exaggerate, but it was something that really concerned us. And I called a bunch of scientists, and they basically one of them coined the phrase. It may have been Larry Brilliant coined the phrase, the Easter Sunday Massacre. And so we started referring to this day as the Easter Sunday Massacre, and we decided that I would call the White House and see what it would take to convince the president to change its mind. And so that was my first time I called Jared Kushner. It was the first time I ever spoke to Jared Kushner. And I said, after some pleasantries and a genuine offer to help, just to say, hey, look, whatever party people are in, this is a moment to pull together. And he said, great, love your help. I said, here's where your challenge is right now, is this Easter Sunday thing is a bad idea. We got to find another way. He said, well, can you write something up for me that I can show the president about a different approach? And I said, okay, we'll do that. And then I got off the phone and said, how am I going to do that? But I went back to the same group of scientists and had probably one of the most challenging conversations that I've ever had. Well, you know how you're trying to push the ball forward on something very linear, and you got 10 people who are each brilliant and each their own opinion, and none of them are listening to each other. And half of whom thought it was fruitless and told me, don't do anything to help because you're just going to justify bad things from happening. And it was one of those events where I'm like, I need to drink heavily. So the only thing I could think of is I need to seriously start drinking heavily. But we ended up cobbling together from a bunch of different sources, like a 5 or 6 page memo. And then I called other folks and said, you ought to be doing the same thing, because I don't want him to just get one thing from me. You ought to just do your own version of what you think needs to be done here. So I called Scott Gottlieb and I called other people I knew the White House trusted. And we sent this thing in, and Birx later told me, as Jared told me, that it was exactly what they needed to put together the plan to think about how you create a system to start based upon case volume, how you make different decisions about opening and closing the economy, and making this not a date-based event like Easter Sunday, but an event-based, like how much is it prevalence you have, et cetera. And so we felt really, really, really good for less than 24 hours, because this is your 24 point. The next day, Deborah Birx announced the plan. And 3 hours later, and just to give you context, Michigan and Minnesota were 2 states that were having real problems and shouldn't be open. The next 3 hours later, President Trump tweeted in all caps, "Liberate Michigan, liberate Minnesota," when we had protesters with guns at both of the governor's mansions, and that undermined the entire plan. It really set us up on a course for a very divisive perspective on what should come next with the pandemic.
How long did it take you, Andy, to respond with that 5 to 6 page memo? Did it take you a day, 2 days? How long did it take you to get back to the White House, though, with that?
It was a few days. It was mostly was mostly spent on phone calls, gathering opinions, calling people, getting their input, and trying to assimilate it into. I think I spent a full day trying to assimilate it into Trump language. Victory, American first victory over COVID, blah, 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 blah. So I got a lot of good scientific input. Then I polished it up a little bit, and sent it over.
The COVID test failure response, originated, at the kind of the feet of the CDC. You talk about in the book. Share a little bit about kind of, how you learned about that and how that shaped kind of how you, how you managed your involvement. Like what did it sort of inspire you to do, think about, or call at that time?
Well, one of the governors called me the day that it was the day that Mike Pence said there were 1 million tests on the field, or it was the day after that, and said the tests just arrived and they don't work. And so I started calling around, and I called to Seattle. I called people running the hospitals in Seattle, who basically told me the same thing. They got some tests, but they don't work. Pieced it together and eventually learned that there were a bunch of labs, national labs and academic labs, that had been offering to put together tests and their own tests, and get them into the field very, very quickly. And the CDC and FDA decided against that. They decided that no, they were going to have one test and it was going to be controlled. And this is to me was an example of probably just a bad call, in two reasons. One is speed. It's all about speed at that point in time, not about perfection. And secondly, when you're in a crisis, and having led a few crises responses before, you try to never leave yourself only one path to success, because if you do that,
right,
and if you fail, then everything falls down. And that's indeed what happened. They came out with a faulty test, and it wasn't just that there was a faulty test, it was that their strategy was completely single threaded through this one point of failure. And so when they failed, it was costly. Ideally, in most things in life, you got to leave yourself a little room to fail and still not have everything completely go to crap. And I think that was a problem there. Now, I will say that's execution problem with the CDC, or decision-making problem in HHS. But also, if you recall, at the time, the president of the United States was saying, there is no COVID, there is no crisis, this is a hoax, this is being blown out of proportion. And so in some respects, saying to the national labs, we need your help, would have gotten them in real hot water with the White House. So I still hold ultimate accountability where the buck stops.
Indeed. One of the scientists that you sort of go back to repeatedly here is Bill Joy. Can you talk about who Bill is? And then, do you think about, and it's particularly during that time, as you saw what Bill said play out, do you think about what would have happened if we did what Bill said? Like, tell us a little bit about Bill Joy, Dr. Joy, and he sounds like a character in the book. So like he could be a real character in a movie.
If they made this into a movie, they could have Darth Vader play Bill. I mean, and he was the guy who, no matter how bad I was hearing, or it was, he could be more pessimistic. In fact, of the over 100 people well over 100 people that I've talked to, interviewed for my podcast, et cetera, scientific experts, he's the only one who in early 2020 said, we could see next generations of this virus that are worse, that are potentially even more contagious. Nobody else said that. Now people may, at this point, like it reflects a 2020 hindsight, say that they knew that the variants were coming, but Bill was the only person at the time who was saying that. Now, he also said almost every other bad thing that was going to happen, and some of which didn't. So I don't know that I give him full credit, but he had a very good ability to see the dark side, the dark possibility, the negative, the most pessimistic case almost every time. And as I read about the book, it came to the point where I was like, Bill, I can't even talk to you anymore. Sometimes I'm like, I just need a day off. Like I can't
Right.
do it. It's so dark. But he was the founder of Sun Microsystems, not really a qualified by his own admission, own description, epidemiologist, but a brilliant person and a voracious reader, super analytical. And he was the kind of person that I want to ask a question of how much would a month delay cost us in terms of lives lost, et cetera, et cetera. And instead of answering me, about a half hour later, he built a model in Excel, a very sophisticated model. Bill's like in his 70s, I think, that he sent to me and said, here, you toggle this, you can ask any question you want. So he's an incredibly generous person. But I've never met anybody more misnamed than Bill Joy.
Maybe Bill Doom, absolutely.
Exactly.
Another person you talked to a lot was John Doerr. Can you talk a little bit about, it sounds like he was one of the first people that you called, like, early on. And tell folks who John is, and then
Yes. So John is an extraordinary person. He is a venture capitalist in Silicon Valley who probably biggest claim to fame is he met the two founders of Google in their garage, who literally, and he wrote like an $8 or $10, $12 million check, I think, $12 million check, which he assumed he'd never get back because it's just two random people with some idea. He subsequently is not only funded a lot of important companies from the early stage, but he's now one of the leading people taking on climate change and healthcare issues and pandemics. He's just sort of used his platform and his wealth to try to solve big problems. And he's a super interesting, curious person who I'd gotten to know. And he was in touch with a bunch of scientists, and he was the first person to send me graphs that soon became these epi curves that everybody has seen. But he was getting them early, and he, as well as some governors, were sending them to me, and they were projecting things that seemed impossible, but turned out to be true, which was what was going on in Italy and in Korea and in different parts of the world, and what would the U.S. end up looking like. So, and he was my connector to a lot of people. If I needed to talk to a famous scientist or somebody else, I would often, Bill and he introduced me to Bill, and he introduced me to Larry Brilliant. So John was sort of a sidekick in a lot of this. He was the person who encouraged me to launch the #StayHome initiative in March. And when we launched it and it was very successful, I'm exposing him here because this was largely done online. He paid to have it also launch into radio in Black and Hispanic communities and in places where people believe there might not be as much internet access. He wanted to make sure the message got across. He doesn't. So he was just a good partner for me in all of this.
So that Departments of Public Health didn't fund that. That was John. Thank you, John Doerr. Right? That's a huge. I mean, I think that's what's interesting about this book is, kind of alongside the administration, you literally were running a response to the best that you could, right? You weren't fully staffed and everything, but American citizens jumped in, which is, I love that part of this whole effort, just to see that in action.
I'm glad you said that last part, because I wasn't running anything, but I was one of countless people who were doing everything they could at a time when it took us all pulling together. And look, there was a time, it's hard to believe now, when we all did pull together. People were sewing masks, people were helping out one another, people were worried and scared, but brought out some of the best in us. And I do agree with you that was I galvanized and captured like hundreds of volunteer movements students who are going to provide free daycare and meals to hospital workers. We've since given away from this book and our podcast $170,000 to organizations that are taking care of people on Indian reservations, on in the Central Valley of California, where you have farm workers, almost all over the map. Today, we just gave money to people who are settling refugees from Afghanistan and helping them get vaccinated and so forth. So it's true. It is truly inspiring, Cheryl, to see that stuff that's out there. It doesn't get a lot of publicity, but it's pretty exciting.
So look, I hope we can take a few questions. I want to encourage our audience to put them in the Q&A. And then I'll work to keep track of them. So go ahead and submit your questions. The New York response sounded incredible. You talk about your business partners, how they also jumped in, and they called like some 85 companies who were donating all kinds of services, telemedicine, transportation, grocery delivery. Can you talk about, you told them, hey guys, I'm going to take some time off from, I think Town Hall Ventures, which is a company that you helped start, and like everybody was jumping in. Can you talk a bit about that New York response? Just kind of ground zero for the U.S. in a way.
Absolutely. Well, look, you've been such an inspiration in the companies and the initiatives that you've been involved in health equity, and we started Town Hall Ventures to try to find the kinds of companies that are focused really exclusively on health equity and just bringing justice to the healthcare system. And it's really fascinating because as healthcare people, as medical people, I'm sure you've observed how hard it is for things to change, even when we know what the right answer is. But this is one of the first times we're tested under fire. We were like, no, things have to change. And so people, all of a sudden, virtual care became something people could do. What we did in New York, I say we, it was so little of it was me. What they did in New York was they essentially said, we need to find a way to reach seniors with medical needs, with social needs, grocery needs, et cetera, so that they don't have to come to the hospital, come to the emergency room. And they basically created a system where Amazon Web Services donated the technology, social service agencies and other companies donated their services. And essentially, people in New York would get a text every morning, and it would just say a very simple question: how are you? And if you said you were fine, you didn't need anything, you just get you'll get one the next morning. But if you said, I need help, then you would get another text saying, what is it you need? Do you need a prescription picked up? Do you need childcare? Do you need food delivered? Are you feeling ill? Do you need some mental health services? And then we would essentially line that up for people. It caused me to ask, wait a minute, why aren't we doing this anyway? Wouldn't it be okay if our healthcare system actually worked this way? Because the people responded very well to it. They felt looked after. Presumably, I haven't seen the end data, but presumably it kept a lot of people out of the emergency room and out of hospitals when they didn't need to be there, and was of some comfort. And people just pulled together. It just shows what people will do and can do in a crisis.
Yeah.
That they don't bring out that game necessarily every day when it comes to what we could all be doing for each other day to day. And I found that both inspiring, and it made me crazily eager to do more, because I know what we're capable of.
Well, in the book, you talk about a playbook, and the United States of Care is I believe it's a not-for-profit organization that you started with this playbook. And so, there also sounds like there could be entrepreneurial opportunities here to take models like this and, sort of move them forward to maybe solve other problems and tackle others. Can you talk a little bit about the United States of Care and where you are now with that organization? What charge has it taken on, Andy? And where do you see it going from here based on what you learned?
So I started United States of Care around the same time we started town hall ventures, really to change policies in a way that would open up access and reduce disparities, and to act as kind of the kind of grassroots voice in public policy debates on behalf of real people. Because I feel like, having been in Washington inside it, I know what happens. The pharma companies have a seat at the table. The AMA has a seat at the table. The American Hospital Association has a seat at the table. AHIP, the insurers, have a seat at the table. And yes, there are patient advocacy groups that get heard from time to time, but many of them are funded by pharma, as we all know. And so it's not surprising when even well-intentioned policy goes astray. Well, you know, not that you expect every policy to be perfect, but it could be better. And the people who really don't have a voice in Washington need a seat at the table. And so US of Care is set up to do that. And you should, if you're interested in, you should check it out at usofcare.org website. It's run by a wonderful woman. And their commitment's great. Yeah, I think you're right about innovative companies like this company, City Block Health, which is a company that we've invested in, which is essentially purpose-built to bring better care for dual eligible people around the country. You know, essentially that is very close to their model, that someone, we can bring care to people's door, bring the ER to you, whether in person or virtually. And the promise that they've made is that if you want to see a physician, not just any care team member, but if you actually need to see a physician, we'll get you a physician in front of you in your location within 45 minutes. And that's what they hold themselves to. And it's pretty amazing because sometimes that's on a park bench. Sometimes that's at someone's home. Sometimes it's virtually, although it is, you know, and I think their premise is, let's stop focusing on equity. Let's leapfrog. Let's focus all our innovation in people who are getting this inferior care, redesign it so that, because I listened and I said, I don't get to see a doctor within 45 minutes of thinking I want to see one. And that's what we want to evoke. We want people to say, wow, you could get better care as a person who's historically been ignored than everybody else. And that's a pretty fun project. There's a lot of work to do and to get up that curve, but I love the ambition.
Absolutely. There's a question about capital projects like air ventilation filtration not being prioritized anymore. Do you think that's the case? Any thoughts there about sort of those projects that could be helpful with other things, for instance, like allergies and other kind of hyperallergenic states?
It's hard to know what's being prioritized versus what's not getting media attention. I mean, a lot of funding was passed to retrofit schools, and money is being raised to do that even more. I couldn't tell you whether or not it's sufficient or more is needed, but like these things happen, they get done, and then the news cycle moves on. I completely agree with the premise of the question, which is that one of the things that has to come out of this is all of our homes, apartments, school buildings, office buildings need to be retrofitted for better ventilation. And the cool thing is that, you know, I don't know if you saw, this is where Twitter is fabulous. These guys created the homemade portable air filtration systems that are the equivalent of a HEPA 13 that anybody can make, and they're like tens of dollars. You can buy a portable system for your school, but if your school won't buy you one, or you can't afford to have a full system at home, these kits are really easy to build and put together. And so this whole that made it much more approachable, because in many ways there's almost no reason why we can't instantly create better air filtration in our wherever we are. We have them all over our house, and we have 5 or 6 of them in our house, because we're all conscious of the fact that, you know, what is going on in your air has a lot to do with your health, not just COVID, right? But
That's right.
all the other respiratory illnesses.
So I'm gonna take this last question. There's two, I'm gonna merge them together, Andy. It's how hopeful are you regarding the future of healthcare and our ability to respond to another crisis of this magnitude? And then, hi, Sue Swider. The other question is, the pandemic is still dividing our country. And then, so what suggestions do you have for those who working with those who continue to resist the vaccine and other preventive measures, right? So you can kind of collapse those two
Yeah.
together because
Those
it's,
two
hey,
belong together, actually.
exactly. So how hopeful are
Yeah.
you? Gosh, we're still dealing with, and all of us are going to the holiday, to be quite honest, Andy. My family is 50-50. I'm from Georgia and I'm going down there and I'm trying to figure out how to deal with my family, right? I'm the eldest grandchild. I think I'm gonna require everybody do a rapid COVID test before we enter into a room together. I mean, because it's, and I don't feel like arguing with them all, right? So
People need to
tell
listen
me,
to you. Who doesn't listen to you?
well, you know what, me the other half of my family. So how hopeful are you? The vaccine's still dividing us. What do you think?
I was hopeful till I started thinking about that. Half of your family might not even listen to you. So look, I think there's two factors that play the most significant role in whether a country is responding successfully to the pandemic. And they actually turn out to be different than the ones that people, I think, thought, but they're both logical. The first one is actually prior experience with the pandemic. So, Hong Kong, they're right on the train and flight line from Wuhan, and they manage this better than anybody because they've been through SARS, they've been through MERS, and so it is. One would think, and in the U.S., the place that has the most serious experience with pandemics is San Francisco, and they have somewhat of a public health infrastructure left over from HIV. So that would encourage me that we're going to be better next time. But the second factor is one that is highly discouraging, and that is how much of a common good there is in society, how much people are pulling for the same thing. And the way that that's most easily measured, or one way that's measured, is looking at the wealth gap between the top decile and the bottom decile. And it turns out those countries with a much closer top to bottom do much, much, much better because we can all empathize with each other much, much, much better. But for you, when countries that have extreme wealth, where people live very different lives, and extreme poverty, and I would say the U.S. is higher on that list, so is Russia, so is Brazil, so is India, the responses are just much, much worse because if we're all acting only to keep ourselves safe, we're of course going to be not addressing the issues that really exist and persist. And what we have in this country is a very divided country. Yeah. I mean, one big topic for IOM, in my view, is we've got 20% or so of Americans that are pretty much down on the record as saying they don't believe in science. They don't believe in institutions. They will not listen to people like you. They will not listen to people like me. They are anti-institutional. Some of them believe in conspiracies. And I'm not trying to demean or belittle them. I'm trying to say we need to understand them because those are people who also influence other people. And so as long as we have these fundamental divides in our society, and I think talking to people about taking a vaccine is not talking to them about a view that began during the pandemic. It's talking to them about a mindset that is deeper and that's been established over longer periods of time. And so it's harder to shake. And I don't know the answer to that. And we don't have enough time left. And it's beyond any one of our scopes, but it's really all of our scope as human beings and as citizens and as residents of this country to figure that out and begin that dialogue.
So the work will continue. Andy, I want to thank you for being with us today. I mean, this was a super interesting conversation and review of your new book, Preventable. And I'm telling you, it was like an episode of 24 for me. Like, it was like, oh God, Easter Sunday, we got to save, we got to save America. But just a great chronicle, detail, very good reading. I encourage folks to, it's a great sort of catalog of what happened, and you had a behind the scenes view. So thank you for sharing that with us. We're going to move to the next part of our program. We know you're very busy, so thanks for
Thank
coming.
you.
We appreciate you so much, and have a
Thank you
great
so much.
holiday with your
Best to
family.
all of you.
Tell Zach I said hi. At this time, we will begin the awards presentations. I'd like to introduce Dr. Jan Odiaga and Dr. Lorenzo Pence, who are the co-chairs of the awards committee. Dr. Pence is co-chair of the awards committee, secretary of the IOMC, and the senior vice president of the American Council of GME, Graduate Medical Education, Osteopathic Accreditation. Dr. Odiaga is a co-chair of the awards committee, member of the board of directors, and director of interprofessional education, associate professor at Rush University's College of Nursing, both of Billings Fellows of the Institute of Medicine of Chicago. Dr. Pence, Dr. Odiaga, I'll allow you to introduce your committee and take it from here.
Hi, thank you very much, Dr. Rudiger. I want to also say that Pat Murrayworth was part of our committee. She's the executive director of the Project Patient Care, and Howard Newsham is also the executive director of the Washington Square Health Foundation. I have to say, and thank you also for the lovely discussion and the retro look at what happened, because it's been so many things so quickly that it's hard to keep track. So today it's been my pleasure to be able to present the Institute of Medicine's awards, healthcare awards, and I am delighted to be here and to see everybody. Today we're presenting 3 healthcare awards. The first one is the Henry P. Rusi, MD Citation for Exemplary Compassion in Healthcare. The second is the IOMC's Invitation in Healthcare and Healthcare Delivery. And the third is the IOM Humanitarian Global Health Award. These awards are offered each year at our annual meeting, and due to COVID this year, we're presenting them here instead of at our normal presentation. So the Institute of Medicine wants to recognize 3 amazing people for their achievements and for their leadership in healthcare, public health, and population health. Nominations were received from colleagues to recognize an individual or an organization that meets the healthcare standards of public health, community health, and population health, and organizations and individuals within. The awards are open to all, and they are not required to be part of the IOM. So the first award I'd like to speak to is the Henry P. Rusi Award, the MD Citation for Exemplary Compassionate Care. So our first award, as I was saying, is going to be, it's a joint award from Rush University, and it's named after Dr. Henry P. Rusi, who serves as the Dean of Rush Medical College from February 12, 1928 to 1991. He also served 5 terms as president of the Institute of Medicine at Chicago during an extraordinary decade of personal growth and professionalism. To recognize his contributions, the trustees of Rush University Medical Center and the IOM established this Henry P. Rusi Award. This ongoing award demonstrates, as Dr. Rusi exemplified, the humanitarian characteristics that are needed for healthcare and healthcare citizens. The IOM and Rush are honored to present this award to Dr. Melissa Simon. Dr. Melissa, I'm going to give you a little background. It's quite extensive, so stay with me, and we appreciate your hard work and wonder when you sleep. Dr. Simon is a fellow of the IOM. She's a critical leader in ensuring health equity is embedded into medicine and healthcare. She leads one of Chicagoland's area's largest and deepest commitment and footprint to promoting health and well-being for all. With 15 years of dedicated commitment to all medically underserved women who touch communities across the Chicagoland area, she without doubt embodies the true spirit of the Rusi Award. She is the George H. Gardner Professor of the Clinical Gynecology, Vice Chair of Research in the Department of Obstetrics, and at Northwestern University Feinberg School of Medicine. She is also the founder and director of the Center of Health Equity Transformation and the Chicago Cancer Health Equity Collaboration and the co-program leader for cancer control and survivorship for the Robert H. Lurie Comprehensive Cancer Center. That's quite a bit. Housed in the Center for Health Equity Transformation, she is an unparalleled portfolio of research funded across 7 NIH institutions. And this past year during the pandemic, she rose to the 4th highest NIH-funded OBGYN in the country. With her entire portfolio of research focused on minority and medically underserved populations, she's partnered with community clinics and organizations across the Chicagoland area. Her workforce development and mentorship programs have diversified healthcare and science workforce. She has trained and mentored students, faculty, and professional people throughout her time. A true testament of her efforts to teach and educate and mentor, she has recently been recognized as being Northwestern's Mentor of the Year 2020. She exemplifies compassion and humanitarianism in the clinical realm. She has been steadfast in her commitment to caring for the underserved, with her only clinical time dedicated to medically underserved women. Her dedication has been clear at this point during the pandemic, and her service on the mayor's Racial Equity Rapid Response Team Providers Steering Committee, where she helped launch and support citywide outreach calls since the beginning of the pandemic. She has substantially contributed to the content and strategy around health equity and healthcare delivery to several leaders across Chicago and in her own health system. She has so many achievements that are beyond what we are presenting to you today. It is our privilege to honor Dr. Melissa Simon today with the 2021 Henry P. Rusi, MD citation for exemplary compassion in healthcare.
Thank you so much. Thank you, Dr. Odiaga. Thank you, Dr. Pence. Thank you to all of the IOMC and to the board of directors of Rush University Medical Center, my alma mater for my MD. And I am just really delighted to have and humbled and sincerely honored for this award. There are so many clinicians and leaders, healthcare and scientists that have contributed to deep efforts to help us through this pandemic, and to be named is just, it's so humbling. And so we have so much more work to do, as Dr. Rucker Whitaker would say, and we need to continue to storm the gates and storm some gates that have yet to not be stormed yet. So I am just really honored, and I look forward to working with the IOMC more closely and just to keep moving forward with lifting health for all. Thank you.
Thank you so much, Dr. Simon. It's been a pleasure to present this award to you. It's been a true inspiration for all of us and all the work that you do. So I have another award that I'd like to present, and it is the Innovation in Healthcare Award. The Innovation in Healthcare, hi Angela. The Innovation in Healthcare Award and Healthcare Delivery recognizes an individual or organization that has implemented an approach, strategy in healthcare or healthcare delivery that enhances patient care and improves outcomes. This person does also not need to be a fellow of the IOM. So it is with my great pleasure to introduce present this honor to Dr. Angela Moss for the Innovation Healthcare Award. Dr. Moss, a fellow colleague of mine, is an assistant dean of the Academy Faculty Practice and assistant professor in the Department of Community Systems and Mental Health Nursing at Rush University College of Nursing in Chicago, Illinois. She's a board certified practicing nurse practitioner with over 20 years of experience as a nurse educator, clinician, and researcher. She is a national expert on academic practice partnerships, and under her strategic leadership, she has built over 30 health equity focused academic practice partnerships. Dr. Moss's strategic partnerships are most often with community-based organizations such as traditional supportive housing and shelters, government agencies, church groups, and advocacy groups who provide social services to underserved populations. Under her leadership, these partnerships have grown over 500% in the last 4 years. She has demonstrated unparalleled dedication for the underserved population of Chicago, people without citizenship, experiencing homelessness, formerly incarcerated, suffering from mental illness, substance abuse, victims of domestic violence, and children. Majority of these people have been living under the federal poverty line and without access to reliable, quality health care. Together with faculty and students working side by side, filling this critical delivery gap, healthcare gap, they provided nursing care to Chicago's most vulnerable populations. And over 100 registered nurses and faculty and students and federal work study students have provided over 100,000 annual care delivery hours to underserved patients, and over 100,000 hours of student scholarship that direct clinical activities. As a result, faculties and students have benefited from partnerships and have developed specialized clinical skills in the care of vulnerable and underserved populations. Community service has a unique opportunity to foster a sense of moral and civic responsibility, a commitment to activism, and promote racial understanding for the participants. Well, for the past year alone, Dr. Moss, through her leadership, has received over $13 million in funding to expand her academic practice and programming supporting the COVID-19 activities. She created solutions during the partnerships and dealt with critical issues of racism, inequality, and injustice and public health. In the beginning of the COVID pandemic in 2020, Dr. Angela Moss worked with her community partners developing tailored COVID plans touching over 10,000 lives. In partnership with the Chicago Department of Public Health, she established the city's isolation facility for COVID-19 infected people experiencing homelessness. So to date, over 500 people have had the opportunity to have a home while experiencing COVID. She created a vast network of nurse faculty providing primary care in 20 shelters, serving over 200 guests each week. And she also created COVID testing teams throughout the Chicagoland area, congregations and encampments and shelters. All of this work she put into play to help mitigate the spread of COVID. So it is our privilege and my honor to present to Dr. Angela Moss today with the 2021 Innovation in Healthcare and Healthcare Delivery.
Thank you so much. I'm a little speechless. I actually do sleep. And I'll say the reason I'm able to sleep is because hearing everything you said, it's really all of this, it's all about the partnerships. All of this work is possible because it's done in partnership with basically everybody, with people in the medical center, with people out in the community, with the Chicago Department of Public Health, a Safe Haven Foundation, which Nellie will talk about in a moment. But there's really, teams of hundreds of people who are all doing this work across the city every day. And so it's such an honor to be counted among this group of influential leaders changing lives in Chicago. I'm really grateful and humbled for this honor, but I also share it with everyone that I work with. It's really a reflection of all of their efforts. One of my personal missions is to work to dismantle the barriers that our patients face, that to increase health equity for all. And I think that this work, the reason we've grown so much in the last several years is because this resonates with all of our partners and everyone else who's doing this work. And I really believe that we're stronger together, and that's why we're able to achieve the outcomes that we've been able to achieve. And I do have an update. We have, you mentioned we have had 500 people through our isolation facility, and actually we're up to 1,000. We've had people come through the isolation facility. The team is hard at work today, as they are every day, running that operation. So I just want to say, thank you so much. The nurses and the clinicians that I work alongside with every day, and all of our partners that I work with every day, we're all out there changing lives. You all remind me of the power we have to transform outcomes, to advocate for our patients, and to lead with empathy for people from all walks of life. And I'm so proud to work alongside all of you. You're all healthcare heroes. And thank you again, Jan, for nominating me for this award. And thank you to the IOM and to the committee. I really am truly honored. Thank you.
Thank you. I'm proud to be a nurse. I'm proud to see the impact that nurses have on the overall health of the population. So it's been my honor. Thank you. I have one more award that I would love to present. And this is our Humanitarian Global Health Award. It's presented to Chicago, Cook County, and Collier counties, individual or an organization that has provided voluntary, longstanding, and international humanitarian health services. The recipient, too, does not have to be a member of the IOM. So it is with my pleasure and honor to speak to Nellie Vasquez Rowland, the co-founder and president of the Safe Haven Foundation. She is the recipient of this award. She's a first-generation immigrant, born and raised in Chicago. She hails from Chicago's Little Village community and was the first in her family of 7 siblings to graduate college at Loyola University. Since the mid-1980s, Nellie Rowland worked as a financial advisor, managing portfolios for over 13 years for very high net worth individuals. And she is an alumni of Chicago Public School System and a lifelong Chicagoan. Nellie and her husband, Brian, founded and privately funded a safe haven for 5 years, starting in 1994. She and her husband witnessed firsthand the complexity of human services and the disparity of access to services that existed between people with resources and those without. In 1994, she became personally frustrated in the fragmented approach to homelessness and poverty issues, and by the lack of efficiencies and accountability and outcomes by both public and private efforts. So along with her husband, Brian, they began both public and private efforts. They began to investing in real estate to provide housing and substance abuse counseling for people recovering from drugs, alcohol addiction, and homelessness. So since that time, Nellie and her husband took the leap of faith and made this and her family their family's work. That's quite a job. After 5 years of funding and building this pilot, she left her 13-year career to pursue her vision and found a new calling to create a place that served as a one-stop shop to help people in crisis transition to jobs and permanent housing. Today, a safe haven operates one of the largest human services agencies in the Midwest, managing a network of 40 real estate developments and 4 social business enterprises, providing employment for individuals with multiple barriers to employment and have earned a second chance. She's been the driver that has scaled the Safe Haven's work, which now employs nearly 200 credentialed employees, manages an annual operating budget of $16 million, over $50 million in assets, and promotes 2,000 units of phased housing, including transitional, supportive, affordable, and senior housing, and programs that include individualized case management, nutritious meals, drug and alcohol treatment, mental health, and healthcare, and job training. Because of Nellie's unique background, she leads an example and has contributed to the success of a safe haven. Her goal was to position a safe haven to effectively serve as a behavioral health model that connects the dots and serves as a one-stop shop for each person impacted. More importantly, she's created an innovative model that serves as an alternative to the criminal justice, and criminal behaviors and lack of educational opportunities. She firmly believes that solving root causes for homelessness and poverty issues can reduce the incidence of crime, emergency, healthcare cost, and academic challenges. As the Safe Haven, a model focuses on streamlining the continuum of care, and anecdotal evidence provides that it helps individuals help themselves and live their lives with pride and purpose, and empowers people to pursue their unique path in self-sufficiency. Currently, the Safe Haven has impacted over 110,000 lives and annually serves over 5,000 men, women, and families, youth, veterans, and reentry populations, helping them break cycles of poverty with their pride and restore purpose. Last year, she was proud to tout that they placed over 1,500 formerly homeless individuals into jobs. And that's wonderful, Nellie. Thank you so much. Nellie has dedicated her life to building and helping to inspire a new paradigm regarding our nation's approach to the issues of poverty and relating social determinants. And Nellie is also a member of the IOM. So it is with my greatest honor and privilege to honor Nellie Vasquez Rowland today with the 2021 IOM's Humanitarian Global Health Award.
Thank you, thank you, thank you. This is, I believe, my favorite time of year. In the spirit of the holiday, you know, just taking a step back and thinking about how grateful I am today to be here with you and to be accepting this award that anyone on this call I know could have earned. I mean, I know many of you on this call, and many of you I actually met during this pandemic. And, you know, miraculously, we were able to come together and integrate our expertise, our services, our organizations in a way that's ultimately achieving, you know, one of my lifelong goals, and that is helping to really integrate the institutional healthcare system with the community-based organizations that help address all the social determinants of health. And I remember meeting Angela Moss, you know, it was back in March of 2020, and we had this idea, you know, to address the issue of the homeless and the people that were going to be hit hardest by the pandemic. They were likely to get sick and die and spread it. And that gave us an opportunity to really, again, think out of the box and help innovate what I believe is hopefully the future of the way the healthcare delivery system goes in terms of truly connecting institutional healthcare to address all the healthcare needs, and then ultimately connecting them to an organization in a place that's going to be a soft landing that's going to help provide all the wraparound services. I know we had a great conversation. I jumped in a little late, but you know, I think what Andy Slavitt was doing in terms of our speaker, you know, really touched on so many of the things that we agree with and we support. So it's beautiful to see all these minds, you know, incredible minds and people and experts and people that are boots on the ground doing the work to come together and really help shape and influence the new paradigm, which I hope is what we are ultimately going to look at as a silver lining of this, you know, horrific, you know, humanitarian crisis that we're in. And, you know, and remember that beneath the shadows that we have an opiate epidemic and we have a growing homeless epidemic, and we have to have a solution that works for all of us. And I could not be more proud, again, to be a part of IOMC, and so grateful to my board members. Cheryl Whitaker, thank you for your leadership. Thank you to all of the board members. Thank you to the awards committee. Thank you to my entire team at A Safe Haven. Unbeknownst to me, my assistant, Angela, nominated me for this award. And I was just surprised that she did that. So anyway, it just goes to show what an amazing team I have, you know, working day in and day out, and even working with Angela in the medical respite, you know, doing God's work and making sure that the people that we are serving ultimately get to their highest level of independence and are able to achieve their God-given potential. And again, it takes all of us. And I hope that this award helps, you know, elevate the issue of homelessness to truly be considered a public health issue, because ultimately that's truly where it belongs. And it is something we can heal, and it is something that ultimately we can solve by working together. And I look forward to doing that with everybody here. So thank you so much. And of course, I cannot leave without letting you all know you're interested. I'd like to give you all a gift. We came up with a new book called Healing. We wrote this during the pandemic, and it's an anthology of 12 stories of people that have been examples, true examples of what it's like to be homeless, what it's like to get help, and what it's like to actually live the American dream. And if you put your address in the chat box, or if I'm going to put my email in there, so give me your address, and I'd love to give this to you. And again, here's the award. It's beautiful. I can't wait to put it in a place where everyone can see it. Thank you again, everyone.
Thank you, Nellie. Thank you for everything you do. And to everybody that has received awards today, please take some time to relax, get some sleep, enjoy some time with your family, and celebrate the holidays with the people that you most love. So thank you so much. And I would like to recognize a few other people from the IOM Health Recipients Award. It's a healthcare award, and they were all received awards earlier in our June annual meeting, but I just really think it's important that we call to attention the other people that you may not have seen. So there's 10 outstanding individuals, and they are, first of all, we have our Lifetime Award from Mark Shields. He is an accomplished leader and has worked with us at the IOM for a very long time, and we honored that he was given this Lifelong Accomplished Leader Award, Lifelong Award. We also have some Public Service Award recipients that were presented. They are healthcare people that are around the Chicagoland area, and they are presented to a long history of public and valuable healthcare service in public health. As we know, we need them very, very much, and we appreciate everything that you have done. So Karen Ayala, from Executive Director of DuPage County Health Department. Barbara Jeffers, Executive Director, she's retired, but she is Kane County Health Department. Melissa Adamson, Public Health Administrator, McHenry County Department of Health. Mark Pfister, Executive Director, Lake County Health Department and Community Health Center. Susan Olnek, Executive Director, Will County. Karen Joshi, Senior Medical Officer and Co-Leader, Cook County Department of Public Health. Rachel Rubin, Co-Leader and Senior Medical Health Public Officer, Cook County Department of Public Health. Allison Arwadi, Commissioner, Chicago Department of Public Health. Ngozi Ezeki, State of Illinois, Director of Public Health. And I just want to say congratulations to all these people. The pandemic has really brought to light how much we needed our public health administrators and our public health. And this has given them the chance to bloom and grow, and we need you more than ever. So thank you ever so much for what you're doing. So congratulations to all of the 2021 award recipients. Now I'd like to introduce Dr. Clark Stanford. He is the co-chair of membership committee and the professor and dean of the UIC College of Dentistry.
Thank you very much. So I'm representing the membership committee, and the IOMC is really, again, to the strong credit of the leadership of our president. We've really turned around in terms of improving both our programming and also our membership. And one of the things that makes an organization viable is this idea of the strength of the membership. And what I wanted to let people know is we have a little bit more than 200 members currently of the IOMC. And I just want to make sure we are always looking for new, potentially highly qualified members to join the Institute. Again, it can be anyone involved in either direct patient care or health systems. It can be, we have members that cover the entire span from, of course, physicians, nurses, dentists, and all the way to those that are making innovations, as you just heard about, in terms of, I would argue, homelessness is an integral part of the healthcare system, because if you don't have a safe home, you're going to end up having healthcare issues. So all of this is tied together, and that's why the IOMC plays such a good role in terms of bringing what is truly an interdisciplinary types of activities to actually bridge and come up with new creative solutions. So we're always interested in people to be nominated, and anyone in the community, I would strongly recommend that there is a brief nomination approach. It usually takes about 3 to 4 months for the entire process to get approved and reviewed and approved by the board. But again, I strongly recommend anyone, you've seen the example, the pandemic has been a great example of how we've been able to bring new types of programming with a range of different areas of interest, all of which complements the vision and mission of the IOMC. So thank you very much for a few minutes just to make a plug, if you will, for everyone thinking about people you work with on a daily basis and ask, are you a member of the IOMC? And if not, why not? So thank you very much. Here you can see some of the new fellows that joined us in the pandemic of 2020 and 21. And in this case, as you can see, we have Allison Arwadi, we have John Brady, Don Chambers, Ray Crossman, Matthew Davis, Audra Davis, Fernando De Mayo, Ngozi Ikizi, as you just heard, Earl Frederick, Dawn Gay, Helene Gay, Adalola Odawolfi, sorry, pronouncing, and Darlene Hightower, Chris Holliday, Kiran Joshi, Jerry Krishnan, Tamara Kotaska, Fawn Lopez, Doreen Miller, Mildred Oliver, Nancy Parsley, Mark Pfister, Brenna Peters, Rachel Rubin, Joel Shalowitz, Melissa Simon, Scott Tamar, Stephanie Wilding, and Mildred Williamson. The Billings Fellows are listed here. So the Billings Fellow is a special component of those that provide extra support for the mission and vision of the Institute, and you can see the names presented here.
Thank you for attending today's session. And again, thank you again to our sponsors for your generous support of the Institute of Medicine of Chicago and the commitment of our Board of Governors and our members and colleagues for the support and participation. Over 1,000 people have attended the virtual sessions over the past year. This is a record for IOMC. It is also a successful effort, as this is the first time IOMC conducted virtual sessions. We are excited about the future. Please follow us on LinkedIn, check out our blog, and visit the IOMC website for details. We wish you wonderful holidays and a healthy and prosperous new year.
Thank you, everybody, for attending this session. Again, we want to wish all of you a merry and happy holidays. Be safe and enjoy.